Hi everyone, my name is Sarah Clark, and I'm going to be presenting on hearing loss in pediatric patients with cerebral palsy. To begin, let's break it down. Cerebral refers to the brain, and palsy refers to the loss or impairment of motor function. So when we combine the two terms, we get cerebral palsy, or CP, as it'll also be identified as throughout the presentation. It's caused by damage to or abnormalities inside the developing infant brain that disrupt the brain's ability to control movement and maintain posture and balance. This is as a result as CP affects the motor area of the brain's outer layer, also known as the cerebral cortex, the part of the brain that connects muscle movement. According to the literature, it should be noted that CP is the most common physical disability in pediatrics, as it occurs in 1 in 500 live births. Most children presenting with CP experience spastic and rigid muscles that affect movement, but also may experience other complications or disturbances that include intellectual impairment, cognition, speech disorders, communication disorders, behavioral disturbances, epilepsy, and vision problems. Another one of these potential complications is hearing loss, which will be discussed further in this presentation. So exactly what causes hearing loss in an infant or child with CP is not always understood, but there are many potential causes that we will dive into now. As in many cases, the cause of CP is unknown. Possible causes include genetic anomalies, congenital brain malformations, maternal infection or fever, and fetal injury. According to the literature, children with CP have an increased risk of hearing loss, with approximately 20% have some level of impairment, and this can present as partial or complete hearing loss. Researchers link this number to other medical conditions associated with hearing loss, such as jaundice, low birth weight, congenital infections, and lack of oxygen to the developing brain. It was also found within the literature that 3.3% of deaf or hard of hearing pediatrics present with CP as well. Particularly for children with CP, hearing loss can lead to problems with language and social development. Therefore, early identification and treatment of hearing loss is of paramount importance. And we know and have discussed extensively that this can maximize a child's speech and language development, cognitive development, and psychosocial skills. Testing to determine the extent of hearing loss may include behavioral audiograms, visual reinforced audiometry, and conditioned play audiometry. It should be noted that these hearing tests could potentially be more difficult with children who have CP because they are limited by their ability to control their body movements. However, skilled professionals can adapt and make modifications in order to make this a pleasant experience and to get accurate results. Now we're going to look at the types of hearing loss that a pediatric patient diagnosed with CP may present with. And they include conductive hearing loss, sensory neural hearing loss, or a combination of the two, which is defined as a mixed hearing loss. So just to review, conductive hearing loss occurs when the conduction of sound through the outer and middle ear is disrupted, therefore affecting hearing before the sound reaches the cochlea and the nerve receptors of the inner ear. And then sensory neural hearing loss results from damage to the neural receptors of the inner ear, the nervous pathways to the brain, or the area of the brain that receives the auditory stimuli. So according to the literature, Wire et al. Found that hearing loss in CP has a large degree of sensory neural loss, also with a predisposition to be bilateral. He also found that the severity of the hearing loss often correlated to the degree of the motor and disability in these patients. The literature highlighted that within the general population, approximately 50% of sensorineural hearing cases involve genetic disorders, but in contrast, among children with CP, non-genetic causes are more likely, and they include hypoxic ischemic encephalopathy, very low birth weight, premature birth, intrauterine, and postneonatal infections. So now that we've identified the types of hearing loss pediatric with CP may present with, let's look at the impact of such hearing losses. So the literature notes that hearing loss can have a profound impact on a child, especially if it's not diagnosed and treated. Not being able to hear adequately can lead to delays in all kinds of development, especially language, speech, and social development, and can potentially put them at risk for becoming socially isolated. Novak et al. Found that treatments directed towards the underlying cause and developmental and educational interventions can help improve the effects of the impairment. And this all goes to saying that hearing loss does not have to be a permanent disability for a child with CP if treated and addressed correctly. Now we're going to transition into the management. Interventions for hearing loss vary depending on the nature of the impairment and underlying cause. Some possible treatment and solutions include the use of hearing aids, cochlear implant devices, voice output devices, and surgery to correct malformations or injuries, if that's appropriate for that specific individual. So in addition to medical treatments and forms of assistive technology such as hearing aids and cochlear implants, children with hearing impairment may benefit from speech language therapy. And then children who have potentially a more severe hearing impairment may need sign language instruction and augmentative and alternative communication devices, also known as AAC. So in conclusion, all the literature identify that early diagnosis begins with a medical history and involves using neuroimaging, standardized neurological and motor assessments. The clinicians should understand the importance of prompt referral to diagnostic specific early intervention to optimize, infant motor and cognitive plasticity, prevent secondary complications, and to enhance caregiver well-being and patient satisfaction. Also, as allied healthcare professionals, we need to be abreast on evidence-based practice, up-to-date prognostic information, and have this information at our fingertips so we can communicate effectively with the families and caregivers, and then to continue to develop appropriate interventions for the trajectory of the treatment. So in closing, to summarize, interdisciplinary treatment is defined as the best practice, and we should collaborate to build a successful program for the child. Below are some questions to consider and potentially pose to the team, kind of like food for thought questions that I thought would be good to present. And just a few I want to draw your attention to is like, will the child's hearing aid be adequate for the activity, or should other devices such as an FM system be considered? What about AAC devices? And will their hearing aid and or low vision devices interfere with adaptive equipment and other augmentative communication devices? So here's a list of my references from the literature reviewed. I hope you enjoyed this and have a good day.